Good morning, students. Today we see about upper limb, means surface anatomy of upper limb, skeleton of the upper limb, joints of upper limb, muscles of upper limb, then nerves of the upper limb. See one by one. The surface anatomy of upper limb is that upper limb is divided into five category. On the shoulder, arm, antearm, forearm, hand, and axilla. Okay. Then the surface anatomy of upper limb is called landmarking of this like lateral epicondyle, medial epicondyle, oblique and fossa process, then cubital fossa, anterior surface of the elbow. Yes, the cubital fossa supply contents of the brachial artery and median. Then boundaries mentioned be medially is the parietal teres, laterally is the brachioradialis. Then superior line between the epicondyles. Then carpal tunnel. The carpal tunnel is a carpal concave anteriorly. Carpal ligament is covered. Then the carpal ligaments covered contain medial long tendons from this area. Then horizontal stub box. The laterally it's the extensor pollicis brevis muscle attached. Medially it's the extensor pollicis longus muscle attached. The floor is the scaphoid and stellar of the radius attached. Contents of the endovascular stub box is the posterior to the radial artery. We check for the radial position in this area. Then structures of the clavicle and bones of the upper limbs, the clavicle, scapula, humerus, radius, and the carpal proximal to distal to metacarpal and phalanges. The both side. Then the scapula is posteriorly is for the anterior surface and posterior surface. Anterior surface is ventral, posterior is dorsal. Then to the posterior surface attached to the spinous scapula. This is spinous scapula. This is the long. The front of the process is acromion. Below the process is called a crooked process. Then the spinous scapula, above the muscle attachment is the supraspinatus. Below the spinous scapula is the infraspinatus. Then the ventral aspect is attached from the subscapularis fossa muscle. Then subscapularis. Then the middle part is mainly for status anterior, teres major, teres minor. Lateral part is mainly for rhomboids major and rhomboids minor. Then the clavicle, the humerus bones. It is on bones of the hand. Then clinical understanding of the bones of the clavicle is commonly fractured at the junction between the two cavities of the bone, falling an outstitch of the hand, mainly for cleidocranial dissociation. In scapula, mainly for ankle anatomy, winging of scapula. Then humerus is three nerves are related to the nipple injury. Axillary nerve at the cervical neck level, radial nerve at the boob level, ulnar begin the middle epicondyle level. The common site of the fracture, surgical neck, shaft, to supracondylar region. The Hookman ischemic contractures, dislocation of the head of radius is common, middle epicondylitis, lateral epicondylitis. Student elbow is more common. The radius bone is mainly for Cooley's fracture and Smith fracture. Ulnar bone is mainly for fracture of olecranon and dislocation of the elbow. Then joints of the upper limb mainly for shoulder girdle is a two joints, sternoclavicular joint and acromioclavicular joint. Arm is mainly for upper end is a glenohumeral joint, lower end is a below elbow joint. Then forearm is mainly for humeroradial joint, humerulnar joint, proximal radial joint, and distal radial joint. Distal hand is mainly for intercarpal joint, carpometacarpal joint, metacarpophalangeal joint, and interphalangeal joint. Then muscles of upper limb mainly for there's two muscles attached to the upper limb to axial skeleton. Upper limb to axial skeleton, muscles of the upper limb into upper. Then there is a muscle attached to upper limb to axial skeleton, mainly for four muscles. Anterior is present for pectoralis major, pectoralis minor, subclavius. Middle for saccus anterior. The pectoralis major is mainly for origin of the sternal half of the clavicle, upper half of the sternum, then upper muscle of the external oblique muscle. Insertion is the lateral lip of the intertubular sulcus. Then action is the adduction, rotation, flexion of shoulder. Nose supply mainly for middle and lateral pectoral. Pectoralis minor is mainly for costocondylar junction of the third, fourth, fifth ribs. Insertion, coracoid process and middle and upper surface. Action is that draws the scapula forward or depression of the shoulder. And also there is a middle and lateral pectoral. Pectoralis minor mainly for costocondylar junction of third, fourth, fifth rib. Third, fourth, fifth ribs. And just make coracoid process of the middle and upper surface. Action is the draw the scapula forward, depression of the shoulder. Then subclavius, the subclavius we attach in front. And first to report the costochondral junction, then subclavian view of the clavicle suggestion as it studies the clavicle. Then now suppose now to subclavius in the upper trunk of brachial plexus. Then satis anterior is the outer space surface of the first atrium. Origin from the outer space surface of the first atrium. Inches in the superior angle, superior angle, middle quarter, and inferior angle of the scapula. Action is mainly for rotate the scapula forward, and impulse of the shoulder capsule and release. Nose is mainly for long thoracic movement. These are what we discuss. Next class.